Having a baby is a major trauma for a woman's body, and it really takes time to recover, believe it or not. Now, there's no such thing as a standard postpartum period, but it is common for the first few periods to be quite different. And joining us this morning to answer all of our burning questions on postpartum menstrual cycles is gynecologist and obstetrician Dr. Jason Bennett, the good doctor. He's with us again. Hello, doctor.
Hi, thanks for having me again.
So good to have you with us. Very important topic. I remember 2 years ago, believe it or not, when I had my little one, the first time after getting my period again, I was even like, it was strange to get it again. I was like, what is this? Why is my body doing this? Obviously, it's going back to normal. But for women who don't know, how long after having a baby will your first period come?
No, you're very right. People get very scared about their first period and they're not sure when it's going to come, if it's going to come, and if there's something wrong. But most of the time, if you're not breastfeeding, your period will come back in about 6 to 8 weeks. If you are breastfeeding, it'll be a little bit longer. If you're exclusively breastfeeding, it's unlikely that your period will come back until you stop breastfeeding.
What is the link between that two? Because you're saying, so if I was breastfeeding, it would take longer for it to come back. Does that, the first period or the period, affect the breast milk supply in any way?
No, totally. So there is a link. When you are breastfeeding, you produce this hormone in your brain called prolactin. And what prolactin does is it tells your breasts to make more breast milk for your baby, but at the same time, it also shuts down your reproduction system. Okay, so you stop ovulating and you will stop having a period because of this prolactin.
Oh, interesting. I never knew that because I didn't breastfeed. But what can women expect with their first period? As dreadful as it is, your body has to go back to normal. What can they expect?
So you're right. Your body does have to go back to normal. You've kind of had a 9 months break, so things will take a bit of time to get back to normal. Your first period won't be as you had before. You may notice there's a little bit more bleeding, and the flow may be a bit different. So you may get a little bit of bleeding that starts, and then it stops, then it comes again, so it's slightly frustrating. You may have a little bit more cramping, okay? And you may have a bit of an irregular cycle for quite a while.
Is there any red flags or symptoms that we should look out for when we get that first period?
So initially, after having a baby, be it by a normal birth or a Caesar, you will bleed for a little bit straight away, and that normally lasts a few days. After that, you start producing something called lochia, which is kind of a milky, clearish, reddish discharge, okay? And your first period will be quite bright red, and that's how you notice that you are having your first period.
And then what should we do if we notice anything irregular with regards to that period?
Yeah, so things to watch out for. If you are soaking pads, if you're bleeding for more than 7 days, if you're having severe lower abdominal pain, or if you start developing an offensive or bad-smelling discharge coming out, if you start having fevers, it's something to go and chat to your doctor about.
Well, answering all of our burning questions, Dr. Jason, it's always so good to have you with us to weigh in on this conversation with regards to that first period after having a baby. So thank you so much.
Cool, pleasure.
And of course, for you at home, after not experiencing a period for many months during pregnancy and breastfeeding, the backaches and the pains postpartum don't need to be unbearable. BRUFEN helps aid period pain as well as inflammation, making easing back into the swing of things a lot smoother.
Targets pain caused by menstrual cramps. BRUFEN works where it hurts.